Herkese günaydın. Burada Amerika'da.
Could you please wait just for a second? We have some other audience still coming in.
Gotcha.
We can start right now.
Okay. Good morning, everyone in the US.
Herkese günaydın. ABD'deki ve İstanbul'dakilere de iyi öğleden sonraları Dünya Türk İş Konseyi webinarına hoş geldiniz. Toplum tabanlı eylem, tıbbi bakım ve tıbbi ekip verebilmek için toplumlara COVID-19 esnasında adım Esma Yusuf. Bu webinara ben moderasyon yapacağım. 2020'nin en önemli konusu bu oldu. Bu istisnai bir yıl oldu. Ortak deneyimlerimiz oldu, dersler çıkardık. Tabii ki öncelikle sağlık hizmeti verenleri, STK'ları ve iş toplumlarını hatırlamak lazım. Onlar kolları sıvayıp ihtiyacı olan toplumlara yardımda bulundular. İlk olarak Sayın Nail Olpak, Dünya Türk İş Konseyi Başkanı, kendisi açılış konuşmasını yapacak. Buyurun efendim. Çok teşekkürler. Hepinize sağlıklı ve güvenli günler diliyorum. Bugün size ev sahipliği yapmaktan onur duyuyorum. Türk İş Konseyi webinarında. Tabii ki dualarımız hayatlarını kuranların ailelerine gidiyor ve hasta olanlara da en iyi dileklerimizi yolluyoruz. Ben spesifik olarak doktorlara, hemşirelere, sağlık çalışanlarına, bilim adamlarına ve araştırıcılara teşekkür etmek istiyorum. Onlar çok konuşuyorlar. İnanılmaz zorlayıcı şartlar altındayız ve gururla söylüyorum ki hiçbir zaman işlerini bırakmadılar. Pandemi bizi daha çok evlerimizde tuttu ama hemen adapte olduk. İlk günlük hayatlarımızda, sonra da iş etkinliklerimizde. Bu girişten sonra kısa bir izahatıyla devam edeyim DEİK ve DTİK konusunda. Belki bazılarınız biliyordur. DEİK, Dış Ekonomik İlişkiler Kurulu Türkiye'nin, DTİK de Dünya Türk İş Konseyi. DTİK tabii ki DEİK'in şemsiyesi altında 146 diğer iş konseyiyle birlikte çalışıyor. Bütün dünyada iş görüyor bu iş konseyleri. Bir yerde bir diaspora tipi bir organizasyon. Ana amacı Türk diaspora üyelerini bir araya getirmek, siyasi görüş, sosyal durum, etnik veya dini background ne olursa olsun. Bu açıdan iki ana önceliğimiz. Bir taraftan biz kolaylaştırmak istiyoruz networking'i ve ticareti diaspora Türkleri arasında ama güvenli bir ortamda olsun istiyoruz. Diğer taraftan dünya çapındaki iletişimi kuvvetlendirmek istiyoruz yurt dışında yaşayan Türk toplulukları arasında. DİTİK olarak biz başka dost diaspora organizasyonlara da yaklaşıyoruz. Onların desteği ve katkıları çok önemli tabii bizim hedeflerimize ulaşmamızda. Bizim sloganımız herkesi kucaklamak, bak gözetmeksizin. Biz nefret söylemleri ve ayrımcılığın karşısındayız. Evet, diasporalarımızda daha kuvvetliyiz. Bir de tabii dost diasporalarla. O açıdan ABD çok önemli bir ülke bizim DİTİK kuruluşumuz için. 400 binden fazla Türk ABD'de yaşıyor. Ayrıca hatırı sayılır miktarda dostane diaspora grupları da var. Onlar çok etkili ve bizim önceliklerimizi destekliyorlar. Umarım daha çok birleşip daha çok ticaret ve yatırım için çalışacağız. Pandemi ana konusu oldu çoğu webinarların Mart'tan beri sanıyorum. Bugün bildiğiniz gibi konumuz toplum tabanlı eylemler, tıbbi bakım ve ekipman sağlamak için COVID-19 esnasında. Doktorlar var bizimle. Kendileri sahada mücadele veriyorlar. Onların deneyimlerini dinleyeceğiz. Önerilerine kulak vereceğiz. Gurur duyuyoruz onların cesaretinde. Türkiye paylaşım ve yardım kültürüne dayanarak tıbbi yardım gönderdi 140 ülkeye aşağı yukarı. Pandemiye karşı mücadelede yardımcı olması için Türkiye'nin dayanışma, eee, damgası bütün, eee, yardım paketlerine kondu. Umutsuzluktan sonra çok umut vardır. Karanlıktan sonra da çok parlak günler gelir. Evet, Mevlana'yı barışla anıyoruz. 2020 kesinlikle hatırlanacak bir yıl olacak. Umuyorum ve inanıyorum ki insanların dostluğu ve dayanışması hepimizi daha çok bir araya getirecek. Bugünkü olaylar, bütün bunları bize hatırlatıyor. Teşekkür ederim. Teşekkürler Sayın Alpak. Evet, işbirliğine ihtiyaç var tüm dünyada kültürler ve ülkeler arasında. Çünkü bir önem çıkardık biz COVID-19 krizinden. O da işbirliği ihtiyacı ve gerektiğinde yardım edebilme. Şimdi Derya Taşkın'ı tanıtmak istiyorum. Kendisi DTİK Amerika Başkanı. Kendisi bize açılış konuşması yapacak. Teşekkürler Asma. Teşekkürler Sayın Nail Olpak açılış konuşmanız için. Çok teşekkür ediyorum ilk yanıt verenlere, doktorlara, hemşirelere, herkese. Kendileri büyük bir fedakârlıkla çalışıyorlar bu zor dönemde. DİTİK adına çok teşekkür ediyorum katıldığınız için, olan bitenler konusunda bize içgörü verdiğiniz için. ABD'de ve diaspora bunun bir parçası olmak için, bu başarıya katkıda bulunmak için ne yapıyor? Bunları dinleyeceğiz. DİTİK üyeleri adına teşekkür ediyorum ve her birinizin başarısına kulak vereceğiz birazdan. Teşekkürler Derya Hanım. ABD'deki diaspora topluluklarından bahsederken hakikaten bir anlayış köprüsü olmaya çalışıyoruz onların kendi vatanları ve ABD arasında ve o kadar önemli hizmetler yaptılar ki topluluklarına burada ABD'de, ayrıca kendi vatanlarında. Şimdi konuşmacımız Doktor Samiha Porakçı'ya hoş geldin demek istiyorum. DC bölümünün başkanı, Pakistanlı Doktorlar Derneği'nin başkanı Kuzey Amerika'da. En büyük tıbbi derneklerden biri bu Kuzey Amerika'da. Ve şunu da söylemem lazım. Bir hafta bile geçmiyor ki Facebook'umda kendisinden bir hikaye görmeyeyim. Hep girişimleri konusunda, yaptıkları çabalar konusunda hikâyelerini paylaşıyorlar. Teşekkürler Doktor Pirakça katıldığınız için. Çok teşekkür ederim bizi davet ettiğiniz için. Çok onur duyuyorum doğrusunu söylemek gerekirse. Çünkü
So thank you again. A little bit about
bu
UPNA.
yılı hani böyle bitireceğiz galiba. İlk başta yerel derneğimizin 170 var ve temelde sosyal çalışma organizasyonuyuz biz. Topluluklarımıza hizmet vermeye çalışıyoruz, doktorlarımıza, doktorların ailelerine eğitim sağlamaya çalışıyoruz. Ama sosyal çalışmamızın ana tarafı hep Pakistan'daydı, ihtiyaç oradaydı. Fakirlik, gıda ihtiyacı, sağlık bakımı ihtiyacı. Bu yıl pandemide şunu anladık ki yerel toplumun bize ihtiyacı var. Aileler iş kaybetti, yemek bulamadı. Bu şekilde topluma hizmet verme fırsatı bulduk ve bence iyi bir iş çıkardı. Üyelerimiz ve arkadaşlarımız için $200.000'dan fazla para bulduk bu yıl. $30.000 bulduk kişisel korunma ekipmanı için. Burada yerel hastanelere, doktorlara bunlara bağışladık. N95 maskesini bir hafta kullanmak çok zor bir şey çünkü umarım bu yerel hastanelerimize yardımcı olmuştur. Bir de yerel ofislere bağışlarda bulunduk. Onların kaynakları yoktu. Pandeminin başında zordu çünkü ücretsiz devlet tesisleri bulmak. 2 merkezde ücretsiz test yaptık. Sonuçtan 24 saatte geldi. Takip ettik. Hastaları doğru yönlendirdik. Eylül'de eyaletler ve bölgeler hakikaten çok yardımcı oldu ücretsiz COVID testiyle. Bu şekilde başka projelere odaklanabildik. Sanıyorum yaklaşık 20 tane gıda etkinliği hizmetinde buluştuk yıl boyunca. DC, Virginia, Maryland. Ne yaptığımızı bile bilmiyorduk ilk başta. Yani bir grup doktorduk, yaptığımız iş bu değil. Öğrendik, Walmart'a gittik, Target'e gittik, keşfettik. İşte fiyatlar nerede daha ucuz diye yöneticilerle konuştuk. Bağış yapacağız, biz bize biraz daha ucuz verir misiniz mallarınızı dedik. Sanıyorum ortaklık
Partners this year, churches, Islamic organizations, financial organizations, and I'm just so appreciative of what we accomplished in this pandemic. I hope that UPNA is now remembered as really being a part of the community and helping out, because that was the main goal, really, to serve our community. And I'm proud of our members really stepping up. The amount of money they donated, we had to close their offices in the beginning of the pandemic, but they were still paying the salaries for their staff. Obviously taking a loss for themselves. And they were the physicians who every other day I would see a check for $500, $1,000, they just kept donating. And the, pandemic just, I think, really taught us a lesson that what's important and the only thing we have is our good deeds. That's all we're going to take with us. And I hope that we can partner with you guys in the future and keep the momentum going, even when we, overcome this pandemic. One thing we do plan for 2021 is to really try to help with the COVID-19 vaccine and help the public, everyone get vaccinated. So if you would like to partner with us, that would be amazing. That's our next big project. But thank you so much for having us.
Thank you so much. I mean, it's we could have a whole webinar just talking about APNA and the great work that APNA does for the local community, and also for your community in Pakistan. It's interesting that you bring up the issue of the food drive that your organization also had to be involved in, because one of the devastating aspects of the COVID-19 crisis is the fact that, first of all, it was abrupt, it was sudden, and as you mentioned, so many people, first of all, they were uninsured, they don't have medical insurance, and they don't have the capacity to deal with the medical attention and care that they needed to begin with. But a lot of them lost their jobs, and they didn't have the means to buy the basic necessities for their families and to provide food and what have you. And, it's incredible that you had to adapt and you had to adjust your priorities and also be involved in that aspect as well.
Yeah, exactly.
Yeah. But you mentioned that you're, having plans to roll out the new vaccination. We're seeing yesterday that some of the frontline workers, and there was a nurse in New York City who was the first one to receive the vaccination. Are you planning to collaborate with the local health authorities? What do you envision as moving forward with that?
Just like everything we've done this year, we will learn as it goes. Right now it is the frontline care workers that will be provided, hopefully, the vaccination. So once the time comes where there is, more companies putting out the vaccine and we have access to them, we'd like to do clinics for the underserved, for the uninsured, the ones who don't have access, try to provide free vaccinations for them. And we will learn as it comes out. Right now, we don't have a plan because there's not enough vaccine out there for everyone yet, but hopefully we'll be part of that, in the next, I would hope by.
Okay.
Asma, maybe we go to our next participants.
Okay, we'll do that. Next, I would like to invite Dr. Oh, Dr. Mesh is back. Let's see if it works this time. Okay, never mind. Dr. Sene Akten, who is the Vice President of the Turkish American Medical Association. Dr. Atkin is the Director of Specialty at NYC Health in New York, and she's the author of a book in Turkish on the perspective of frontline healthcare provider in New York City. Thank you so much, Dr. Akten, for being with us.
Thank you, Ms. Yusuf. I'm honored to be here. First of all, to present me this way, and also very, very happy to find out the organization that you actually, that Nail OPAC introduced me. Hopefully, we're going to be more involving in near future with another extensive project that we have. So yes, we are living in unprecedented times in our lives. Unfortunately, as a frontline doctor, I'm sorry,
No, go ahead, please. I'm sorry.
Okay. Amish, do you want to continue it? If you would like to.
No, please. I'll follow you. It's okay. Sorry, but.
So yeah, in those times, since we are in the New York City, I have been working almost 5 years in a major community hospitals corporation HHC Health and Hospital Corporation, which serves around 7 million New Yorkers. In pandemics, New York City, that as we are earlier epicenter of that pandemic, we've been hurt a lot. So since we have a lot of communities where they are already unfortunately socially dispirited, they did have a lot of wounded areas before the pandemic. During the pandemic, they did already increased their unfortunate health effect. So we've been dealt with almost 60% of Afro-American communities here in Brooklyn. So unfortunately, 35% of those communities that we got really bad outcomes. And then unfortunately, we had understanding during this pandemic, the social disparities is beyond social distance. So we learned as a group, what I'm actually presenting, we learned to cooperate more often during the pandemics. I worked as a frontline doctor in ER and in floors, trying to help the patients who came with the COVID-19. It was very educated experience, in the same time increasing your ability to be aware of the populations and community health. So during the pandemics, I was also in the program which were actually make me thought and probably promote me in my actual organization, Turkish American Medical Associations, is a media and medicine program in Harvard. I was doing that project to increase the awareness of the kidney disease in the population, especially poor outcome, poor income population. And when we had this pandemic, unfortunately we had the same zip codes. We found that they hurt a lot. So when you look at that zip codes, that you are seeing that they are coming from low income families. Since then, actually, the project that I am also involved, we start I start choosing the way, speak up and do the liaison of between the countries, what we have there, what we have here, almost identical. So it's developed countries that we've been in, as been told that, when we hit by that kind of pandemics, what we learn is we are not ready to really embrace of the scope of this pandemics. We've been very, very critical position in New York City. That made me thought about the equality of the inabilities in global perspective. That's why I would like to increase the awareness of the importance and severity in New York City to my country, Turkey. I tried to initiate the liaisons through the media that I was already involved to increase the awareness in Turkish community what the pandemic is, what's going to be happening if we cannot do proper actions. So it's been a lot of like a journey for me to start it since one of the first speakers says I never had that I was going to be in this position, but since you are in the front line as a healer or like a dealer, I can say dealer most of the time because healer part is always been blocked that since we don't have like treatments for the patients, so we deal the patients and we were actually like trying to navigate our ways to really help a lot of like large populations in Brooklyn. And also like in the same time that we were thinking that we are part of like the community. So in the organization that I actually like worked, we try to collect our physicians the all like experience to share. And definitely we did like a couple of fundraising to the events, unfortunate tragic events, what happened during the COVID-19. Not only COVID-19 only, we have like also bad earthquakes recently in one of the like western part of the country, our country. We tried to raise the awareness of also the other community ongoing unfortunate issues. So not only for
I want to come back to that. But it's interesting, when you talk about, I think people who are not in the medical field, we can only try to imagine the toll that the last 9 months have taken on the physicians and their families and what have you. And one of the interesting things that you mentioned in your book also, and in your presentation from before, is about mental health. And we talk a lot about the toll that COVID-19, the lockdown, the quarantine, staying at home, not being able to socialize, and not being able to see loved ones during very special times, around the year, the toll that it's taken on the general population. But very little attention is given to the mental health toll of COVID-19 on the physicians themselves. And I would like to ask each one of you to give us your perspective. But what would you like to say about that? Because as you mentioned, Turkey was the epicenter, was a hotspot, so to speak, of COVID-19 crisis in the early stages of it in the US.
Yeah, that's actually like you mentioned that mental health in the pandemic is just sort of like aftermath for us, the mental pandemic. So in the beginning, with all those rush and obligations to handle, our healthcare professionals here try to forget themselves to just like sort of heroic way of like helping. But eventually, like what we learned, 45% of depression rate is been seen in like New York City among of like all healthcare professionals. We knew that 300 to 400 healthcare professionals per year having like a unfortunate suicide events, but we were seeing like in the past 9 months it's increased like 25%, just like in New York City. I lost that's what has come to my actually book. I lost one of my beloved friends, Dr. Doreen, who was, I couldn't like say was, still it's just like it's ringing in my hand, who got like her life with like all those burden of what probably she saw. That actually like is going to be taken care of properly, because the liner, like all frontliner, needs to be properly protected, not like with the PPE only. They need PPE on their mental health. So for that reason, here HHC system, we created a very good like talk program. Recently, I also involved with increasing the podcasting just speak up what you like, vent off from the people who really needs to have. And we have a 3K program just trying to get to like, you know, the same experience to share some kind of like we call global psychoanalysis in the healthcare professionals to make them really understand what they've been through. Because this is a, listen, I'm just really underlying, this was surreal for so many people. Since you are actually locked up in a home, we were actually here, even though really seeing what we faced, still it's surreal for so many healthcare professionals. It just like it comes right after, like, right after you've done all those your obligations.
Let me ask Dr. Sami the same question, and then I'll segue back to Dr. Ramesh, because we missed out our introduction of him, and I wanted him to tell us about all the great work that LAA also has done this past year in terms of lending their expertise here in the US to the Libyan CDC and the Libyan health authorities as they sought to combat COVID-19 during a time of war in Libya. Dr. Samia, would you like to also weigh in on the issue of mental health and the toll that it's taken on the physicians and their families?
Yeah, I think, you know, it's physician families and our whole entire community. And I think as physicians, we suppress our own mental feelings. You know, we've always dealt with seeing our patients die in front of our eyes, and we've had to suppress that feeling and not really take it to heart, because maybe that made you a bad doctor, right? You know, you needed to move on and go to your next patient. And this year, we're hearing more and more mental health issues. You know, physicians who didn't have a history of anxiety or depression are suffering, just like we know when they're on medication, getting therapy. I think one hopeful thing is from the physician community is this light at the end of the tunnel, the vaccination. I think it's the first time in the past few weeks that we have happiness. You know, every physician you talk to, like, you know, that vaccination is coming out. So I'm hoping this really, you know, for me, it's like the first good news, you know, from this pandemic, something we've been waiting for. And I hope as physicians, we can show that excitement to our patients and communities to convince them to have the vaccination too, right? Because that's such a big issue. So whatever's behind us, I hope we can overcome. I think with the vaccination coming and us being together, I think it's hopeful, and it definitely helps my mood. So I hope it does for the whole physician community.
We hope so too. Dr. Issam Amesh, as I introduced earlier, he is the president of the Libyan American Alliance, and he played an integral part in coordinating efforts between his organization and the Libyan Health Ministry during the time of the early months of the COVID-19 spread in Libya, which also coincided, unfortunately, with the armed conflict in that country. Thank you so much for being with us, Dr. Amesh.
Thank you, Asma, and I'm sorry for the technical glitch that took place earlier. Bismillah ar-Rahman ar-Rahim, President Alpak and everybody at the World Turkish Business Council and DEİK, thank you for hosting us today. And thank you for recognizing really the efforts of the medical professionals, the warriors who have taken on this war that was not anticipated nor expected, but it is exactly what we do every day. I have the privilege of being a surgeon who does acute care surgery, but also the president of the Libyan American Alliance, who works on political advocacy and community organizing. And we've been doing that in Libya. And so it wasn't a difficult shift for me to gear up what we do in advocacy to put it in place for the management of a pandemic or dealing with medical crises, which is something that is, of course, dear to my heart. But let me begin by recognizing and thanking the Turkish government for being one of the first responders really to the challenge in Libya. Libya has a very poor, unfortunately, health structure. That's the result of 42 years of dictatorship. And so when the pandemic hit, although it did not hit Libya hard initially, we were very concerned about Libya's ability to respond to it adequately. And since April of 2020, the Turkish government has been very gracious and very supportive, and have in fact contributed quite a bit, especially to PPE and testing and things that the Libyan people needed. And so that's only a testament to the wonderful relationships that we have and the heritage that we both share. So I hope that continues. But let me put a spin on a little bit of what the Libyan American Alliance did in this, I think, pandemic that speaks to what all communities in diaspora have done to try to support the efforts of something that's global and impacting everywhere, and dealing with it while we're dealing with it here in the United States. For us, it was a matter of converting the advocacy tools that we have into supporting a country that was in need. As I mentioned, the poor state of the healthcare system in Libya made Libya very vulnerable. The civil war that was ongoing, unfortunately, and the conflict that was happening also had made conditions much more difficult for Libyans and for the Libyan government to deliver the proper care that's needed. But the Libyan American medical community is large compared to Libya's population and professional cadres. The Libyan Canadian medical contingency also is in the hundreds, if not in the few thousands of physicians, which is a big number, as I said, in Libya. But so one thing that we started to do from the get-go is establish a task force that can recruit the talent out there, especially in the fields which are most needed, whether it's pulmonary, critical care, and whether it's the infectious disease aspects or even the science aspects of the pandemic, to try to identify the public health aspects of it, as well as medical supplies and so on and so forth. And we were able to recruit some good talent. One of our colleagues who was in the Gulf area was in fact one of the senior members who managed the crises that have taken place in that part of the world. And so he was able to provide some expertise when it comes to how we can manage crises, and especially the ones that require containment and require the ability to provide community education and the tools necessary to be able to contain a pandemic such as COVID has been. And so from that came out another array of services where we were able to establish a hotline that responded to the needs of the clinical warriors, if you may, on the ground. People who needed to know what to do when they're dealing with crises that were coming from all kinds of directions. We had some telehealth, initiatives that helped to not only educate clinicians, but also to provide them with ways of management, best practices, and so on and so forth that are delivered by top-notch, pulmonologists and ICU caretakers here in the US. We've developed that into educational seminars, which were held in wider scales. So that was one aspect that I think diaspora was able to provide. We took it up to cooperations with civil society organizations. Some of the civil society organizations in Libya were trying to expand and amplify the support of the WHO and eventually other countries' support of Libya's effort to contain the pandemic. And so partnering with them, linking them to US-based expertise and CDC or other agencies that were doing programs and putting out instructions as to how to manage certain problems became very helpful, and that of course led to the development of wider relationships. Because of our advocacy work, we were able to link with major government agencies, the Libyan Center of Disease Control, the CDC, and the Ministry of Health were agencies that we were able to link with. And so we developed this work now into like strategy planning and discussing things with the minister and with the teams that have been assigned the responsibility of organizing that response in Libya. And as I said, Libya is a small country, and although it has resources, unfortunately, it's very difficult to put these resources in use. And so linking strategic expertise, not just for our community, but also finding it in the US government and in the US agencies, and being able to create some conduits of exchange was very helpful. I think the WHO in general has been also very helpful in countries across the world, and particularly in Libya. I was very impressed by what I saw from their programs. But the US CDC was very important also in taking the lead in setting the standards for a lot of these policies. And so that has been very helpful.
Dr.
Another thing we did was, yeah.
If I may, I just wanted to follow up on that. So do you feel from your, with all these efforts and the galvanizing of efforts from the Libyan American doctors and the Libyan Canadian doctors, and as you mentioned, Libya is rich in oil and it's a rich country with relatively small population of only 6 million, but yet the challenge of containing COVID was extremely difficult, given the fact that because of the infrastructure, the health infrastructure in the country today, and different factors. But do you feel that what is the appetite of the population? Do you feel like, first of all, they are in a better shape today than they were 9 months ago? And then what's their appetite in terms of the rolling out the vaccination? Because we also, Dr. Samia talked about it briefly earlier. You do have, there are some myths and fake news and things surrounding vaccination and, the validity of it and all of that. What's your assessment of that?
Yeah, so let me take it back one point and then I'll answer the two questions that you had. The last piece that we needed to do really was to make sure that we are front and center in anything that the United States, which is a huge government, of course, and with a lot of resources, be able to provide. So the United States has allocated about $14.7 million through its agency, the United States Agency for International Development, to do programs in Libya. And it was important, I think, for any advocacy group, and this maybe is a lesson to other diaspora communities, is to be in the forefront of bridging, that support and being able to identify with Libyans, who is best or where is best to be invested. So that was, I think, very helpful. We had programs with the Libya External Office, which is kind of like our embassy in Tunisia, and we were able to engage the Department of State here, their Office of Population, Refugee and Migration, put another additional 3.5 million that we were able to help at least, guide or give some insights as to how best it can be invested or used in Libya. So that was an angle that I wanted to highlight as well. But back to your question, Asma. So in terms of Libya, because of the poor infrastructure, our initial message was containment, because we were very concerned. And many of our colleagues in our team were in fact intensivists who lived in Libya, were pulmonary, pulmonologists who actually, practiced in Libya, and they know how insufficient is the healthcare infrastructure in Libya to manage even hundreds of ICU cases, let alone thousands if the pandemic was to expand. So in the early days, in March and April, in February, March, April, the focus was about how do we contain this? How do we help the population recognize that the best thing is to follow all the, the guidelines that are necessary. Of course, as the pandemic progressed, unfortunately, we did see crises where the ability of the healthcare system to absorb has not been sufficient. And that was kind of like heeding the warning that we initially said. It is in some ways a blessing that part of the world, and in fact, Africa in general, has not been hit as hard as many other parts of the world for multiple reasons, but Libya was, in a sense, blessed in some that regard. But now we're seeing a high escalation. We're seeing the continuation of the war, unfortunately, until very few months ago only had made it very difficult. So now the people are coming back to their senses. There is fatigue from the quarantines and from the curfews and things like that. But people are trying to kind of get back their ability to contain it so that it doesn't become a bigger crisis, because they have seen that outspurt of problems. And so when it comes to the vaccine, I haven't really seen any significant movement from the Libyan government to procure enough of the vaccines. I think people are still kind of recovering from just dealing with the curfews and the second spike that's coming and how to deal with it. I'm sure the vaccine discussion is going to come up and it's going to become an issue soon. Libya is also, as you know, Asma, is dealing with an ongoing political crisis and a looming war and challenges that sometimes, unfortunately, makes people not pay attention to something as the pandemic. But we need to continue to give them that awareness and do what Dr. Paracha said, you know, maybe take an initiative on the vaccine and be able to stay ahead of that curve.
Thank you. Very sobering assessment of the situation in Libya. I want to go back to Dr. Akten. And, you know, we mentioned about how, you know, the world was taken by surprise by COVID-19. And President Olpak also talked about the PPE's donations that his organization was had committed to distributing and sending to so many different countries. You know, it's when COVID-19 hit here in the US, I remember talking to my sister who lives overseas, and she was astounded and shocked when I told her that I couldn't find antibacterial sprays or basic gloves or masks that, you know, people were almost, and people were hiking up prices. And she said, oh, it's in my local supermarket. And she couldn't believe that I lived here and I couldn't find these. And how important was the PPE aspect of all of this. You know, according to the WHO, every month, frontline health responders around the world need 89 million masks per month. And we talked about this, Dr. Acton, and they also need 30 million gowns per month, 1.9 million goggles per month, 76 million gloves per month. What has this crisis taught us about our level of preparedness and how to prepare for the next virus? Because unfortunately, yes, we're happy there is a vaccination and hopefully everyone will be on track to receiving it and will be protected. But you know, all the scientists and the researchers are saying something else is going to come up later down the road, and we have to be prepared. What's your thought on that, Dr. Atkin? Oh, you're muted.
So thank you. Okay, are you hearing right? Okay.
Yes.
So as you mentioned that like requirements for PPEs are like somehow like fixed. So as you said, 89 million, like 90 million masks. So 2.9 million liters hand sanitizer. So we requires this based on like, you know, the individual assessment. So when we have here in the beginning, what we don't have actually just represent as how unprepared we are to that kind of like really big scale of issues, especially like, you know, pandemics. So it's like, that's why they call it pandemic, not a local. It's just like, you know, furiously like increased demanding to the point that, as you said, like it's supposed to be like a lack of. So what we actually like, what we learned during this process, that those requirements are essential, right? Essential and needs to be provided by governments, like, or by like community healthcare officials. It can't be provided by private organizations, private companies. So that's the time that we could like say as a lack of things. We did not lack of. We didn't collect together. We didn't aim together to have them. So if you remember, like in the first 3 weeks of the lack of and all those scenes which been like, you know, seized to the all medias, the people are not have, nurses have no like N95. We are not, I don't have, I didn't have. So I was telling, we were also telling and writing up the private sector, like our fields, needs to be raised up, like, you know, step up to the, like, you know, to the issues that needs to be done immediately. So we learned the you know, I'm coming back like the organization that you have, why important is, why the importance there, because of like all those community work which needs to be done, provided not only like, you know, the main like funded organizations, you should also help out with the private organizations. And there must be like, we don't have that kind of legs there prepared for this kind of issues. This pandemic teach us how to reach out to private companies and telling that, hey, this is community, this is health issues, this needs to be done together. So I think that's why like after like again 4th week of that, we sign up like all those the private funded coalitions agreements from the government. Since then, we learned we got actually helped out from the state with actually provided private organizations plus minus like the companies to handle that. So the question that you ask, we are not going to be prepared to next one. I can guarantee you we will have that kind of sluggish efforts. If we can fix it as of now, that we learn the health issue is not a private issue, like private, that's why I was trying to understand. This is like a more, I shouldn't say a social medicine, but I came from the country that the health is for everybody without price or affordable one. So the way of that we lived in New York City or New York in the United States, we've been actually getting the all health care with price. This price being actually, unfortunately, paid by lives when we hit this kind of pandemic. So I believe that my actual thoughts about this particular issue, we need to increase these coalitions between the states and the private sectors more often, and probably create another institutions which actually only focusing on these defect areas which we saw already in the pandemics.
Dr. Paracha, I was wondering if you wanted to add something along those lines to, what are some of the lessons that we learned about, providing something as simple and as basic as PPEs to frontline health workers, the shortages that we saw and the scarcity of resources. As a community organization that has done amazing and tremendous work, what are some of the learned lessons that you can share with us about how to prepare for the next one?
Well, unfortunately, this year we learned that we can't rely on our government, which I don't know if we ever felt before living. I was born and raised here in the U.S. and did I ever feel like that? No, I felt like our, government would take care of us in something like this. So, I think I learned, and we learned that we as a community can take over and help. We as the private organization, as volunteers, can take action, and something that I didn't, before maybe would say, oh, I wish the government would do this, would do that, but take it upon ourselves, however we can help. So if there's another catastrophe in the U.S. or around, and our community needs us, we'll just have to take action. I think that's what we learned, to just do what you can as a person and as an organization.
Dr. Amesh, I wanted to get your thoughts on this as well. You're muted.
Okay, sorry. Now, I think the lessons of the pandemic have been tremendous on everybody. I think on the healthcare providers, I think it reinforces our commitment to science and to the need to stay ahead of something like this. I wish we have seen more emphasis placed on being able to forecast problems like this and to be able to put in place the mechanisms by which we can manage and deal with these. I think it cannot be overemphasized. I think what we saw in terms of the heroic commitment and roles of the clinical care team has been tremendous and uplifting, despite the challenges and despite the hardships that everybody encountered dealing with this. As late as last night, I was operating actually in a room where the COVID patient is, and so it became a matter of daily routine, but the challenge is still there. We're very hopeful with the vaccine coming up. And we, thankfully are one of the first recipients of the vaccine. But I think it can't be done unless we're a community. And we've learned that what happens across the globe, and when I saw that in Libya and saw how, the need for us to understand that it's no longer the isolationist mindset that will save us. Unfortunately, that's what the current administration has done. But rather, it's the global vision that we're one village, that when a person in Tanzania aches, the person in Washington will also ache. And I think that's a big lesson for us, to try to understand that the health of the world community is the health of America, or the health of Libya, or the health of Turkey, or anywhere, or Pakistan, or anywhere in the world. And I think these are very important for us, because as diaspora, we come from both worlds. And all our lives is about, reconciling and building the bridges and making sure that we understand across. And so I think we bring these, this richness, this background, this heritage, and really, and I go back to what Turkey has done by, sending even PPEs to the United States. I mean, I think that's very telling. That's very powerful sign that, we're one brotherhood, we're one, world, we're one, future. And I think those are the lessons that we need to, amplify and work together. And I'm honored to be in the company of my Turkish brothers and sisters. And I love Turkey. I spend a lot of time there visiting. And like Asma said, I find myself finding a home there. I have some family there already, and I plan to spend a whole lot of time. But the best thing about it is just being part of both worlds, something that for 40 years we've lived away from, and to just make this connection and make it meaningful in healthcare and touching human life and in bringing wellness to others and share in those best practices, I think is heartwarming and something that will keep us moving forward. So thank you.
I wanted to turn to President Olpak to sort of get his view on. First of all, thank you so much for hosting this webinar, because I think it's very timely to sort of during December of every year, we usually look at this past year, what has been done, what has been accomplished. Did you get to accomplish your goals on a personal level, on a professional level? But I think December of this year, everyone is still trying to get a grasp of what really hit us. COVID-19, nobody prepared for it, and nobody really, absorbed mentally the toll that it would take on our families, on the frontline health workers and providers and the physicians and the nurses, and the tremendous work they've done on behalf of humanity, putting themselves at risk and going above and beyond the call of duty. And today we showcased all of these various community efforts and diaspora community efforts to provide that essential need to their immediate communities here in the US and also abroad. And I echo Dr. Amesh's message about oneness of humanity and brotherhood. I wanted to turn to President Olpak and see where does he see the World Turkish Business Council? What are some of the initiatives and some of the projects that perhaps you will also be doing and extending to communities in need moving forward?
In fact, of course, I want to answer that question, but do you think it will be better to ask this question to Derya Taşkın to be able to give let's say time for her?
Yes.
At the beginning, I had touched some points. For that point, I believe she should say something more.
Daria, what would you like to say on behalf of DTİK Americans?
Well, on behalf of the DTİK Americans on our board, we are here to help anyone in need, in any diaspora community that needs or that are missing resources that could reach out to us. And we are here to help them not only to get the necessary PPEs, but as you guys had mentioned, mentally too. If there is anything that needs to be done, I mean, we as the Turkish American community here to help any diaspora group. That's why the intention of this meeting was to let everyone be aware. Thank you for Dr. Amish for illustrating how the Turkish community is out here and then supporting the PP. I mean, we had in New Jersey about 2 months ago, the Turkish government had sent masks and uniforms to the hospitals. Not only to the hospitals, but to those in need, to homeless and other communities that are out there. So we are here and with these meetings to get the word out. I think that's another important factor too. Just to get the message out is another important factor, that we are here in whatever necessary there is out there, so anyone in needs could reach out to us, and then we could help.
Thank you. Thank you. I think this wraps up our time for the webinar today. I would like to go ahead and thank all of our guest speakers. I know you have very busy schedules, and some of you are actually today conducting your participation in today's webinar from a hospital or from a clinic or a medical center. So thank you so much for having the time to share with us some of your very unique perspective, how you navigated this past year as doctors. Thank you to Dr. Sene Akten, the Vice President of the Turkish American Medical Association, Dr. Isam Umesh, the President of the Libyan American Alliance, Dr. Samia Paracha, the President of this DC chapter of the Association of Physicians of Pakistani Descent in North America. Thank you, President Nail Olpak, for hosting today's very important webinar. And thank you to Daria Tashkin of DTİK Americas for also hosting this webinar today and for your input. Thank you all. And stay safe.
Thank you.
Thank you so much for having us.
Thank you.
Thank you.